Well, is there anyone who doesn't know someone who has flu at the moment or has had it in the last couple of weeks? A shout out to my son James, who's got it at home at the moment. The latest numbers from the health department show a sharp rise in the number of cases, more than 17,000 people testing positive for the flu in the past fortnight. And have a look at this state by state breakdown for the past 2 weeks. You can see another 6,000 flu cases in Queensland, 5,000 in New South Wales, 3,000 in Victoria. The health department tells us it's too early to judge whether this flu season will be particularly bad, but they do note the, quote, impact on society, unquote, from people getting sick is increasing with work absences and school absences and the like. And joining me now is the editor of the Medical Journal of Australia, Professor Nick Talley. Nick Talley, thanks for joining us.
Pleasure.
Anecdotally, I mean, you talk to your local chemist, they say this is the worst flu season for ages. Is it an unusually big one, do you think?
Well, it's too early to know, but the trends in the last couple of weeks, I think, are worrying. And certainly there are some public health physicians who are believing at the moment that we're going to have a pretty severe flu season this year. And it's certainly going to be a lot worse than the last couple of years. There's no doubt about that. We've had some deaths from flu, thankfully low, but there've been deaths. There've been 500 plus hospitalisations. It's going up. We're seeing more cases in hospital. COVID's also going up. So it's not good news all around. And I think that's important for the public to know, because the influenza vaccination rates are not high enough either. So we're not protecting ourselves as much as we can.
Do you think people have had enough of needles after COVID?
I think they have. I have no doubt there's a bit of PTSD around vaccination, really, for COVID and for flu, probably. But people need to realise you can protect yourself at least to a significant extent, and it's sensible to do so, particularly if you're elderly, particularly if you're immunocompromised or have other serious health issues. Getting an influenza shot, which is largely free for those populations, really is incredibly sensible.
Is it a question of our immunities perhaps being lowered by the lockdowns a couple of years ago?
I don't think that's likely. I think the lockdowns actually protected us from getting as much influenza in the community because people were keeping their distance. Some people, many were wearing masks. They weren't spreading virus as much as we are now. Once those public health measures have gone, then the virus is much freer to circulate. That's the reason we're seeing the resurgence of flu. Is COVID related to this in some way in terms of changing our immunity? We're not sure. There's not enough data to be sure about that. It's possible, but I think less likely.
Most people are pretty off the idea of wearing a mask these days. So what else can you do to not get afflicted by it?
Yeah, look, I think it's a good question, and I understand why people don't want to wear masks, although for those who are at high risk, it might be more sensible to wear a mask, at least give themselves some protection from this. I think the issue is this. People who are sick, if they stay at home and prevent the spread to others at work and hopefully at home as well if they can, that can be very valuable. Circulating the air when you're in a closed environment can reduce viral spread, not just COVID-19, but also influenza and other viruses. And that means obviously considering opening windows if there's poor ventilation, or potentially even buying systems that allow you to circulate the air more effectively so that you reduce the risk of acquiring a virus. So that can be done, but it is difficult and it's hard to avoid the flu in this season. It's going to be even harder as cases go up. So again, considering vaccination, which is recommended for everybody over the age of 6 months, that should be something people should think about.
And just finally, it does seem to me from talking to government officials and other people that they don't want to say this because COVID still kills people, but it's a less serious virus now. Omicron helped with that. The vaccination helped with that. Really, it's only if you're over 80 and have some health issues as well now, it's fair to say that you're at massive risk from it.
Well, you're certainly at massive risk if you're older or if you're immunocompromised. There's no doubt COVID's still killing people. There's been an 8% increase in hospitalisations for COVID. there are now more than 5,500 cases a day in Australia. So while the emergency is over, COVID hasn't gone away. It's still causing some havoc. And so I think, again, getting a booster shot, which is available to Australians, a booster, free booster in 2023, that is something you can do to prevent or protect yourself from COVID. And I certainly have had my booster, and I hope people will consider this because, again, it's underdone in Australia. There are many unprotected people, even amongst the elderly. More than 50% have not had a recent COVID booster when they probably should.
Professor Nick Talley, thanks so much for your time this afternoon.
Thank you very much.